myeloma is actually a precursor, is actually the end disease of two precursor diseases. So MGUS, the monoclonal gammopathy of uncertain significance, people have no symptoms with that disease. They have a abnormal protein in the blood, not a lot of abnormal protein in the blood. They'll have abnormal plasma cells in the bone marrow. So the main cell that is causing all these problems, the main cancer cell of myeloma is the plasma cell. That's the cell that we'll talk about that is causing all the problems. In the same way that if you have lung cancer, it's the lung cells that turn cancerous. If you have colon cancer, it's the colon cells that turn cancerous. And in myeloma, it's the plasma cell that turns cancerous. If you have small amounts of those cells, then it's MGUS. If you have a bit more, and that's very common. About almost 4% of Black people over the age of 50 will have MGUS. Most don't know that they have it, and it has a low chance of turning into myeloma. You have a bit more plasma cells in your bone marrow, and that protein that the myeloma produces is a bit higher, then you could have smoldering myeloma. Again, no symptoms, and that's that 10 to 20% we talked about. And if you have true multiple myeloma that we need to treat, then you're going to have lots of plasma cells in your marrow. You're going to have that you can have any one of those CRAB criteria, the high calcium, kidney damage, anemia, bone disease. Or if you have lots and lots of plasma cells in your marrow, that's 60%, or the protein levels are really high, or if you have already have bone damage, you're at a very high risk of ending up with those CRAB symptoms and signs, and therefore we treat those people too. And that's how we make the diagnosis of myeloma.
So I have a quick question.
Sure.
That protein, because I know there's a lot of, especially men that are exercising, working out a lot, they take extra protein. Is that good? Is that protein in their blood going to be different than something from like MGUS?
Yes, it's going to be, very different. So all those proteins that you talked about, that if you drink a protein drink, or if you eat a steak, those are proteins from lots and lots of different places. And so those proteins are just your normal proteins, the building blocks of your body.
Okay.
This protein is what we call a monoclonal protein. Mono meaning one, clonal meaning source, and the source of those proteins is those plasma cells. And you can do just two blood tests, a serum protein electrophoresis and a light chain assay, and you're able to pick out that normal protein amongst all the other proteins in the body. And that's how we detect if people have myeloma. But you're right. A lot of people ask me if do I need to stop eating protein, or should I eat more protein? And then this protein that you eat and the building blocks of your body protein is completely different than this abnormal protein that is made by those plasma cells that are malignant.